Ladies and gentlemen, her.
I'm back. I know it's been a while. There's been a lot happening in my life, but I promise I'm back properly this time. So today's video is quite lengthy, but I think it's a really great discussion that I need you guys to watch. So in this video, I'm going to be reacting to one of the nursing students, male nursing students that I spoke to regarding males in nursing and their perspective and what he thinks might be the possible reason why we have so few male nurses. So it's such a great conversation. So please do watch it. I know it's a much longer than my previous videos, but I know you guys are gonna enjoy it. Enjoy.
My name is student nurse Chugbo Jideofor Akpom. I'm a third year nursing student of University of Western Cape in Cape Town, South Africa. And I'm a Nigerian national. Today we're going to be talking about my experience as a male nurse. I definitely didn't choose nursing. I'm not regretting it now. I'm actually loving it at the moment, but I didn't choose it. It was actually my brother that suggested it.
And it's interesting that he says he didn't choose nursing, because I think for most people it's a given, like, oh my gosh, I had a passion, I want to help people, and nursing is the obvious choice. Whereas with some people, they just go into it because of different circumstances and that sort of thing. So it's definitely interesting to see who who chose nursing and who didn't choose nursing, or who nursing chose for them. So definitely comment down below. I'd be interested to know, did you choose nursing or did nursing choose you?
Obviously, I knew that I had to somehow find funding for myself, because as an international student here in South Africa, you don't get funding from the government, obviously.
And then guys, that's a real one. This whole non-funding, it does hurt a lot. Because like in some universities, your fees might actually end up being doubled than what a South African nursing student would be paying. So not having funding really does make it very difficult for us, and it actually deters some people from not actually entering university. Or for us that go to nursing or that go into university, it's definitely a difficult path to go down. And I know a lot of you will be like, but there's a lot of scholarships and bursaries. Yes, for South African students, there's a lot. And unfortunately, in South Africa, there aren't many that I found. It's usually for other different courses. Like I've seen some for law, I've seen some for like business or science degrees, but for nursing, I still haven't found any.
And then my brother said, okay, you know what? I'm going to help you. One of my brothers said, I'm going to do this, but if you get admitted into any of these disciplines that I'm going to mention now, pharmacy, medicine, or nursing.
I feel like that's the ultimate combination that most people have that go into nursing. You have medicine, which either it goes really well or it really goes badly. Then you've got nursing. And then, I don't know, for some reason, people want to be pharmacists if they're not nursing. What is this thing with pharmacy? Hey, a lot of people want to go to pharmacy. So if you applied for pharmacy during your application, comment down below why.
I'm doing this is because you're going to get, I'll be rest assured that then you can take care of yourself, and you're going to be set if you get into any of these disciplines, and then you apply yourself.
And that is true. I think that's the biggest reason why most people go into the health field, because I know, as dark as this sounds, there's always going to be sick people, and as a result, there's always job stability in a health field. And yeah, and most of the time it's pharmacy, nursing, medicine, and physio is actually doing really well, and dentistry. But this is not obviously a ranking of the different fields in the health sector, but it's just, from the interactions that I have with you guys in the comment section or with other students, it's always, those combinations and that sort of thing. There's no shade to the other faculty.
So, yeah, I applied for these three courses and nursing. So that's how I got into nursing. Then the other questions, didn't the stereotype, deter me from doing nursing? Because obviously there's this big stereotype and this understanding that nursing is for the ladies, is a female profession. There's no denying that.
And that is very true. Hey, like I know in a class of like 100 in my class right now, we have less than 5 boys, and everyone else is female. And it's really sad that it's like that, because I really do feel like we need more male nurses in nursing, because they really do bring a different perspective. And the reason why I'm saying this is there are certain patients that are very uncomfortable having females touch them, which is usually guys don't want a female touching them because it's uncomfortable. I mean, for some they enjoy it, but that's a whole different story. But for most, they find it very uncomfortable, and as a result, they want someone that they can relate to. And as females, we are not always able to do that. Yes, we've got the whole maternal instinct to it. We can act like sisters and mothers and that sort of thing. But guys, they need their bros. Like, a bro thing is a big thing. Because I know, like, recently my brother got burnt. We went to the clinic, and they had to do his wound and stuff like that. Please don't ask why they didn't allow me to do it. Like, I was really annoyed that they didn't want me to do it. And I'm like, such a great wound care. But anyway, I'm digressing here. So we're at the clinic, and his doctor is the one that did the wound cleaning and stuff like that. And then she had to leave. So one of the other male nurses came in to help out and wrap him up and stuff like that. And he was totally like more comfortable now that there was another male nurse there, and like you could see the conversations that they were having. He was more relaxed, he wasn't as nervous. And I remember when we went for a follow-up on his wound, and that same male nurse was there, like he was totally more chilled. He wasn't like afraid of what's going on and that sort of thing. So I definitely do think we need to have a lot more male nurses just to balance those things out, because we are not always able as females to be able to provide that comfort to our male patients. And especially in the pediatric ward, it's very much needed, because guys, they need someone they can relate to, and they can't always relate to females.
And I would say for me, no, it didn't deter me from doing nursing, because I think because of the kind of person that I am, when I want to do something, I do it because it makes sense to me.
Okay, and I really love that you didn't allow the whole it's a female profession to deter him, because with most people it really is a turn off, because they're no longer seen as a manly man because they're doing a female job, which for me it doesn't make sense. Like, in a health field, you're providing health services, so the gender thing like really shouldn't really matter, given them this negative connotation, which I really hate, because that's not the case. So comment down below, if you're a male nurse, have you interacted with any of these stereotypes? Has the whole thing of nursing being a female career deterred you from getting into nursing, or made it uncomfortable or difficult and that sort of thing? Or have you just flourished in the difficulties?
Stereotypes as a result of my choice of study? Not really. I haven't gotten any stereotyping because of my choice of study. I've had people make jokes about it though. Yeah, people say, oh, like generally in South Africa, when you registered as a professional nurse, we have this common name that we call the professional nurses. We call them sisters. So now I've had people make jokes and say, so we call the ladies sisters when they're professional nurses, and then you male nurse now. So when you're professional, what do we call you? Do we call you a brother? Or, so.
Do we call you brother? And I see there's this new term that people are using, Murses. Like, honestly, for me also, it becomes very difficult, because I know I've worked with like male professional nurses, And it's so uncomfortable, like sister. I'm just like, oh my goodness, I can't, because the title sister is a show of respect. The same way you say doctor, you don't say Mr. So and so, you say Doctor so and so. So for me, I feel like if you take away the sister part of it when you're calling a male nurse, you're losing the respect, but you also don't just want to call them by their name because they've earned the title of sister. So now I don't know, do we now create another name for them, like brother instead of sister? Like, how does this work? Like, guys, like, how should we be calling our male nurses? And if you're a male nurse, do you find it uncomfortable for people to call you sister? Or is it just become a normal thing for you and, you're embracing it, that you are a sister?
So those kind of jokes, I've had those kind of jokes, but I haven't really had this stereotype, no.
That's very interesting because I've obviously spoken to other male nurses, and most of them say there aren't many stereotypes, but among the female nursing community, we are aware that there are stereotypes. So now the issue is it just the female nurses that they think that they are stereotypes because we think of those stereotypes, or are they really stereotypes and these students that I've just spoken to don't really interact with those stereotypes? Because I really do feel that there are a lot of stereotypes, but from the people that I've spoken to, most of them say no, they really aren't, and usually it's just a sister thing that's an issue, or it's a female job, but other than that there's nothing. So what's going on with that?
What struggles do I face being a male nurse? Like everything in life has a positive and has a negative. One of the struggles, I don't know if I should call it a struggle, but one of the, should I say, challenges that I've had as a male nurse is actually getting some patients to feel free with you as a male nurse performing some, carrying out some nursing intervention on them, you understand, or doing some nursing duties. Some female patients, especially, some of them are shy.
And sometimes, like, the cultural thing also comes into play, because there are some cultures where certain parts, or you're not allowed to see, like, a male is not allowed to see a female naked if you're not related to them, or if you're not the husband and that sort of thing. So culture definitely comes into play here. And also it's a big thing in midwifery, because obviously in midwifery you're seeing a lot of vaginas and all of that, and for some it's very uncomfortable. And I know some midwives have said that at first it was difficult for the female patients to get comfortable, because they think you do not understand the female anatomy because you're male, or it's just in general it's uncomfortable, especially for people that are quite reserved. You really do not want to be having a guy putting fingers up your uterus to see what's going on with your baby. Like, that's very uncomfortable.
I think in that regard, then it limits to an extent the experience and the exposure that the male nurse gets. As one, they start, on the other hand, questioning your capacity, your capability. You understand? They question your ability to do what you want to do, because they're not used to seeing a lot of male nurses. They see a lot of male doctors, but not so much of male nurses.
And I really hate that way, just because of your gender, people now question, are you able to do a certain task? Especially when it comes to, like I was mentioning with midwifery, because people will think, well, you're not a female, how are you going to know how my reproductive system works? How are you going to be able to provide me the best health care, because you don't know what I am and that sort of thing. So it definitely sucks that we have that barrier, but I think obviously in the opposite can be said, where as females we don't know everything that happens with the male physique, the whole genitalia and that sort of thing. So I think we would all as patients should just be open, like, look, they have been trained to treat me with the body parts that I have, and I need to be comfortable enough to say, it's okay. I know you've been trained to do this. I know you're going to know what to do, but obviously at the end of the day, the patients are given autonomy, and if you really are uncomfortable and you really don't want to let them touch you and help you out and that sort of thing, it's okay, you can say yes. But I would highly suggest that you give them the opportunity, because how are they ever going to learn how to treat a female patient, or how am I ever going to learn how to treat a male patient if you do not allow me to treat you and help you? And in most cases, there's going to be another professional nurse there. So just we must be help one another out in that scenario. Actually, regarding this, like, this was a conversation that I was having with my brother, where when we went to the clinic, like, all the doctors that we saw were females, and he was utterly shocked. He was like, where's all the male doctors? Because I think that's the narrative that most people have, that there's a lot of female nurses and there's a lot of male doctors, which isn't always the case. So as you can see, in all professions, there's some form of stereotype of what the ideal nurse, what the ideal health physician and nurse needs to look like.
One thing, and the other thing, it's not a struggle, it's just something that I have to correct people all the time. When I assist patients and I walk into the room and I'm doing something and they keep saying, oh, doctor, this, doctor, that. So I have to say, no, I'm not a doctor. I'm a nurse. I'm a student nurse.
And it became worse when we were allowed to wear scrubs during COVID, and people would always mistaken us for doctors, and it's rather unfortunate, but also quite hilarious.
So has there been any insensitive comments made to me as a guy? No, I haven't had any insensitive comments. So are there any differences in opinion regarding the proportion of male and female nurses here in South Africa, as well as back home in Nigeria? I don't think the opinion has changed from when I was still back home in Nigeria. I grew up knowing that once you say a nurse, the first thing that comes to mind is a female. I didn't, up until I got to South Africa, I didn't know that a male can actually be a nurse. Because, like I said, I didn't choose nursing, so I didn't really think much about nursing until I started it. So the opinion is pretty much the same in South Africa. People expect the males to be doctors and the females to be nurses, the same way in Nigeria. Although the acceptance level is higher in South Africa. People accept male nurses. Nigeria, a guy would rather sit at home for an extra year if he can't get admission into school. Rather sit at home for an extra year to do something else, like medicine or engineering, rather than do nursing.
Which is rather unfortunate, but I mean, every country moves at different paces, but hopefully eventually every single country will become comfortable with the whole thing of having nurses as males instead of females all the time. And it's very interesting that usually in an African context, everyone assumes that any male who's going into the medical field is a doctor, and any female who's going into the medical field is going to be a nurse. And because there's also the stereotype of people going to nursing because they think it's easier, and if you're going to medicine it's because you are smart and that sort of thing. So then now it also brings the question, are they saying that guys are smarter because they expect them to be doctors, and since nursing is seen as lower grade, females aren't that smart, therefore they must go into nursing? There's also that question, what subpar message are they sending out?
Because back home, if you're a male in Nigeria and you want to do nursing, it's like your colleagues will look at you like, what the hell are you doing? You understand? They start seeing you like a girl. So it's just that mentality issue. But the opinion still remains the same. Are there any positives about being a male nurse? In my own experience, I think yes, there are positives for being a male nurse. And one of the positives for me is drawn from what everybody sees as a disadvantage. So because nursing is such a female-dominated profession, male nurses are very rare. Actually, in the midst of other nurses, and you're performing the same task as they are, you tend to draw more attention to yourself. So being a male nurse already puts you out there. You get recognized, you get noticed more than others. Like in a group of 10, most of the times I'm usually the only male nurse.
It really is so true. Like I mentioned, like we literally have 5 male students in a class of 100. Like the ratio is crazy, like 1 in 20. That's hectic.
Nurses that did this and did that, even if they don't know our names and they want to refer to me, they always say, oh, the male nurse, the male nurse, the male nurse. See, because I'm the only male.
You know, it's very interesting because, you know, in a clinic setting or in a hospital setting, everyone is a sister. Like any patient will call even a student a sister. So, you know, it's very interesting that they've got their own little name going, male nurse, male nurse. Maybe we should just call them male nurse instead of sister. I think that would be a good option. So that they know we're specifically talking to them. Male nurse so and so. I think that would work better than saying sister.
It's actually a positive, because it means that if we're doing the same thing, if I'm doing the same thing as my female counterparts, I get noticed more than they are. So, which means if I put in effort and do my work correctly, then I have, better chances of putting myself out there than they are.
No, it's good. It really gives you the exposure that you need, and especially for male nurses that go into the digital or the YouTube part of life. They really do get noticed a lot because it's a rare thing and people want to know what their experience is, because we are flooded as female nurses. Like literally, if you Google nursing YouTubers, majority of them are females and males are very rare, and as a result they will have more connections with their audience because people are interested, like what's the experience of having a male nurse or being a male nurse.
I believe there's positives there, and then there's some disciplines also that I've been in, like trauma, and in the surgical units, for instance, even in the medical wards.
Manpower, it really, like, they really do help, because yeah, I guess you can say, I mean, there's the whole thing of people like, oh my gosh, we're all equally strong and stuff like that. Biologically, males are much stronger. As a result, having them, especially in a medical ward, oh my gosh, it's amazing. Like, we've got turnings, like, patients that are either paralyzed or they're immobile and that sort of thing. Oh, those turnings are hectic, especially for like patients that are overweight. Yeah, it's a whole different ball game. So having someone who's strong, and if they go to the gym, it's an extra benefit. Definitely the manpower is needed.
I see that my female counterparts struggle with that, and every time they have to come and say, can you assist me here, can you assist me there? And then the patients themselves, no, they feel more comfortable with the male nurse assisting them in things like movement, understand, and then transporting them from maybe
That's
one
an
place to the
interesting
other.
one. I actually didn't realize
They
that.
feel more comfortable with the male nurse because they feel he's not going to drop me. You understand? He has the
He's got the
muscles to keep
muscles.
me, but the lady's going to drop me. So in that aspect, there is a positive.
Actually, just to add on to the positives, like the thing that I mentioned where guys want to have another guy, they can interact, like, I don't know, there's just this whole brotherhood and brotherly bondness thing that just happens between male nurses and other male patients. So it really is an important factor to have to create that relationship with your patients, because, as a female, you can't always connect with your patient like that, and especially like if you have to do history taking for down their issues. Males are very, very much uncomfortable talking about it, especially if they have an STI or they have some issues with fertility and that sort of thing, especially in a clinic setting. So it's very important to take note that having a male nurse there is important, because some patients are just more comfortable with one gender than another, and as professional practitioners we shouldn't be offended with that, because we are all comfortable in different contexts.
What should be done to encourage more male nurses? In my opinion, I think if there's more education out there to, make nursing what it should be, a profession and not a female profession. Educate the male students as to the various facets and aspects of nursing. Because sometimes when we just say nursing, people just immediately go to pans, putting up drips and all that in the hospital. But nursing is way more than that. Nursing goes beyond the hospital setting. So if we can enlighten the male students and have that education out there, that there's more, nursing is far-reaching, that is than what it's advertised to be, I think it will encourage the male students to take up nursing.
It's true, and it's definitely something that I aimed to highlight in the video that I did a few weeks back about your options after nursing and what you can do with your nursing degree, because not everything about nursing is hospital and clinic related. You literally can do many other things, like you can be anesthetist, there's cosmetic nursing, there's this whole thing of nurse practitioner, and I know in the States it's a big thing than it is in South Africa. You can start your own profession. You can just focus on health education. There's some that just focus on management. There's some that focus on infection control and that sort of thing. So it's not always about being in a hospital setting, in a ward and that sort of thing. You can even get up to like SANG level, where you're dealing with laws and policies that nurses need to put into place and that sort of thing. So definitely the education of the public and the nursing students themselves is highly important, and it's something that I'm trying to achieve with this channel.
So if more is done to educate the male students as to what they can do after becoming registered as nurses, I'm sure it will go a long way to encourage them to take up nursing as a profession. Why do I think there are few male nurses? I can't say for sure 100% why, but in my opinion, I think it goes back to the stereotyping. Nursing is a female profession, and if you choose to do nursing, then you're less of a man, you're less of a guy, and more of a woman or a lady. So people just feel like, I can't say I'm a nurse. There's no masculinity in being a nurse as a male. But I think that's not the right idea.
It's rather unfortunate that someone would put away their passion for helping people and wanting to be a nurse just for the image that people want to have, or to still be seen as masculine. You can still be masculine even if you're helping another patient out. Like, really, like, why don't we say that doctors aren't masculine? They also help patients. Like, how is that any different?
Nursing is a profession, and if you study it and be professional, it doesn't matter if you're a male or a female. But I think, like I said previously, there is better education as to the aspects of nursing that there is, other than just the clinical aspect of nursing that people know. Then we might have more male nurses. And just to conclude, what would I tell a male student that wants to pursue nursing as a career? For me, I like to give advice from a point of experience. So for me, like I said in my first question, why did I choose to do nursing? I said I didn't choose it. It was suggested to me, but I agreed with that suggestion because I saw that yes, if I did this, then it will obviously give me the satisfaction that I want in the first place, which is I like helping people.
I feel like that's the motto in nursing. I like helping people.
And helping people that are not well, ill people, to get better. I've always wanted to do that from my childhood. I've always wanted to do medicine, but in Nigeria, that's not always very easy to get into. Something that I also realized when I got to South Africa, that it's the same thing here. It's not very easy to get into medicine. So, but then after my brother suggested, I started thinking, and I told myself, but it's not only doctors.
And I love that he said he was open-minded about it, because you might get into nursing and it might not be what you expected, or you might get into nursing because of other reasons, and as a result of being in the profession, actually discover that there's other things. So whatever profession you're going to enter into, or before you even enter into it, you need to be open-minded that you're going to discover a lot more things about it than because unfortunately, Google is not going to tell you everything. Google does not really translate people's experiences and how physical reality is like. So sometimes you just literally have to go into it, even if you're unsure, and be able to discover what's there, and keep an open mind and find out avenues to get to what you eventually want. Because at the end of the day, we all wanting to help people. We all have a passion for educating and helping other people. And if nursing is one of those, be open-minded, even if it was not your first choice. Because I think this also becomes a big thing for people that wanted to do medicine and took nursing as a second option, or there was no other option, or it's a bridging course for them to get into medicine. If you're in nursing, please don't keep your head there like, I'm gonna get into medicine one day. Focus on what's on the ground level. You are a nursing student at the moment, so enjoy and love where you are, instead of constantly thinking, one day I'm going to be a doctor, I'm going to leave all of this behind. Be open-minded about the options that you have around you to make it the best situation as possible if you eventually do get into medicine. But if not, at least you found something within nursing that you love and you can use.
My advice would be, try to see that part of nursing that appeals to you, and when you find it, I would say go for it. Don't do nursing because of the money. Don't do nursing because somebody told you to do it and it doesn't make sense to you. Because you might end up doing nursing, and when the money is not there, then you regret your decision.
Exactly. And I love that he highlights that. Don't go into nursing with having an unrealistic expectation, or having some fantasy about what nursing is like, or having the wrong mindset about nursing, because you really are going to be disappointed if you're coming in for the money. Because it's a reality in nursing. In a South African context at the moment, nurses are not paid that much. So if you're going into it because you want to get paid a lot, you'll be disappointed, and as a result you end up hating the profession, because the expectations that you had have not been met. So what I'm pretty much just saying is, have realistic expectations of what to expect from that degree. Don't put the degree up here and then you actually realize it's down here. Be realistic about what you're expecting from that degree, and rather be positively surprised when you discover other things than being disappointed.
Do nursing because you've understood nursing and what nursing stands for, and that it appeals to you, and you see yourself being a nurse for a long time. Then you can do nursing and you enjoy doing nursing. I'm enjoying myself so far, then I can't wait to finish studying so that I can also be registered.
But I really love that he's, begun to love the profession, even though it was not always his first choice. And it is very important that you do get to that point, because nursing is very difficult. It's going to be emotionally taxing. It's going to require a lot out of you than most people expect it to. And if you're in it for the wrong reasons, one, you're going to become a really horrible nurse, because all those frustrations and the anger that you have in you is going to manifest into being rude to your patients, being negligent, not caring how you treat your patients because you're not there for the passion of it. And also, you need to have passion to fuel you through the difficult times, because nursing is difficult. It's going to be emotionally taxing, and you need to have that passion behind you to push you forward when things become difficult. Because if you do not have that, you really are going to be burnt out, you're going to be frustrated, you're going to be angry with yourself, and you're going to hate every single minute of nursing to even a point of dropping out. And
I hope I've convinced a few people with my story, and I'm looking forward to seeing a lot of other male nurses.
we need more male nurses.
It would be nice for a change not to be the only male nurse when I walk into the
Till
room.
next time. That was so cute.
Thank you very much for your time.
So much to Chugbo
Till next time.
for allowing me to use this video into this video into a video. So pretty much was almost like a reaction to what he was saying. So definitely this is a conversation that I want to continue having with other male nurses, to obviously get a better understanding and more perspectives of male nurses, because I think it's a really important conversation for us to have. So I really hope you guys loved and enjoyed this video. If there's any other conversations that you'd love for me to get started to talk about, definitely comment down below. I would be more than interested to interact with them. And if it requires me to bring other people on my channel, that would be amazing. Or if you've got a conversation that you would like to have with me, you can also DM me on Instagram and we can work something out, because I really would love to interact with you as my subscribers and just the general public. Thank you guys so much for watching this video. Until next week Friday, 12 p.m. South African time, have an awesome day. Bye guys.